Jeopardy-style question, Zollinger-Ellison syndrome, ZES versus other causes of hypergastrinemia. A 50-year-old man presents with epigastric pain, chronic diarrhea, and weight loss. He has a history of recurrent peptic ulcers that have been refractory to proton pump inhibitor, PPI therapy. Laboratory tests show fasting serum gastrin, normal 100 pg per milliliter, gastric pH 1.0, secretin stimulation test, marked increase in gastrin levels. Which of the following is the most likely diagnosis? A. Zollinger-Ellison syndrome, ZES. B. Chronic atrophic gastritis. C. Pernicious anemia. D. Chronic proton pump inhibitor, PPI use. E. H. pylori-associated peptic ulcer disease. Correct answer, A. Zollinger-Ellison syndrome. Explanation. This patient has Zollinger-Ellison syndrome, a gastrinoma, gastrin-secreting neuroendocrine tumor that causes markedly elevated fasting gastrin, 1,000 pg per milliliter, low gastric pH, 2 acids per 0, secretin stimulation test, paradoxical increase in gastrin levels, specific for ZES, refractory ulcers and diarrhea due to acid inactivation of pancreatic enzymes. Why other answers are incorrect: gastrin level, gastric pH, secretin test response, key features. Zollinger-Ellison syndrome, ZES. Wnt 2.0, acid present, gastrinoma, refractory ulcers, diarrhea, MEN association, chronic atrophic gastritis, H. pylori associated or autoimmune, 200-500 Q5 aclohydria, no increase. Loss of parietal cells, low acid, gastrin. Pernicious anemia, autoimmune gastritis, and 5 aclohydria, no increase. Autoimmune destruction of parietal cells, no acid, high gastrin. Chronic PPI use, 100 to 400 ppend, 4 to 5 mild aclohydria, no increase. PPIs block acid, reflex gastrin increase, not as high as ZES. H. pylori peptic ulcer disease, normal to mildly, variable. No increase, associated with ulcers, but gastrin rarely 200 pg per milliliter. Key diagnostic tests for ZES: fasting serum gastrin 1,000 pg per milliliter, strongly suggestive. Secreting stimulation test, paradoxical increase in gastrin. Gastric pH 2.0, confirms acid hypersecretion. Imaging, CT, MRI, somatostatin receptor scintigraphy to locate gastrinoma. Would you like another question comparing ZES and MEN1?